Your chest tightens, your arm feels heavy, you break into a cold sweat, and suddenly, fear takes over. Am I having a heart attack? In that moment, every second counts. But so does your state of mind. Because while it's critical to seek emergency help right away, it's also critical to stay calm enough to make the right decisions. Hi, I'm Dr. Thomas Carter, and while I'm not here to replace your doctor, I've helped thousands of older adults learn what to do when the scariest moments hit. Today, I want to share 5 simple things you can do to calm your body, your breath, and your brain if you feel a heart attack coming on, or even if you're just unsure. Because panic makes symptoms worse, and calm can help save your life. Let's begin with the first and most important thing to remember. 1. Acknowledge the symptoms and act immediately. The first step to staying calm is to know what's really happening. Heart attacks don't always feel like dramatic TV scenes. They can be quiet, creeping, subtle, especially in older adults and especially in women. Common signs include pressure, squeezing, or tightness in the chest, not always pain. Pain or discomfort in one or both arms, back, neck, jaw, or stomach. Shortness of breath, with or without chest pain. Lightheadedness or fainting. Cold sweat. Nausea. A sudden sense of doom or anxiety. If you feel any of these, even mildly, stop what you're doing. Say out loud, "Something's not right. I may be having a heart event." Why it helps? Naming the experience reduces fear-driven confusion. It activates your logical brain over panic. It helps you prepare for the next step calmly. If someone is nearby, they'll take you more seriously. Do not talk yourself out of it. Do not wait to see if it goes away. Do not convince yourself it's just stress or indigestion, especially if you're over 60. A calm response starts with honest awareness. 2. Call emergency services and speak slowly. This might sound obvious, but many people delay calling 911 or the local emergency number out of fear, denial, or embarrassment. And that delay can cost lives. Here's what to do. If you're alone, call 911 immediately. Put the phone on speaker mode if your hands are shaking. Say clearly, "I may be having a heart attack. I am your age, alone, not alone, feeling chest pressure, or lightheaded." Give your exact address slowly. If someone is with you, have them make the call and stay close. What happens next? The dispatcher will stay on the line. They may instruct you to chew aspirin if appropriate. They'll dispatch help right away. Most importantly, you won't be alone anymore. Why it matters? Having help on the way gives your brain permission to stop panicking. Clear speech slows your breathing. You begin to feel like someone is guiding you, even from a distance. Remember, you are not overreacting. You are protecting your life. 3. Control your breathing. It calms both your heart and your brain. When fear hits, your breathing changes. You breathe faster, shallower, and sometimes even stop for a moment without realizing it. This sends your body into panic, and your heart races even more. But here's the secret. You can slow everything down by simply focusing on your breath. Controlled breathing reduces oxygen demand on the heart, signals safety to your nervous system, helps reduce pain perception, slows the release of stress hormones, helps you stay alert and conscious. Here's what to do. Place one hand on your chest, one on your belly. Gently close your eyes or soften your gaze. Inhale slowly through your nose for 4 seconds. Hold for 1 to 2 seconds. Exhale gently through your pursed lips for 6 to 7 seconds. Repeat for 5 to 10 breaths. As you breathe out, say to yourself, "I am safe. Help is coming. Breathe and stay with me." Each breath is like a message to your heart. Slow down. You're not alone. You're still here. If you can't remember the count, just make your exhale longer than your inhale. That's the most important part. This doesn't replace medical help, but it helps you stay conscious and stable while help is on the way. 4. Sit down and stay still. Avoid walking, pacing, or lying flat. When panic hits, the natural urge is to move, to walk, pace, lie down, or curl up. But in the case of heart pain or suspected attack, movement increases oxygen demand, which can worsen damage. What helps instead, sit upright in a chair or on the edge of your bed. Keep your back supported. Rest your arms on your thighs or a table. Loosen any tight clothing, collars, belts, buttons. Keep your legs uncrossed to support circulation. Avoid lying completely flat unless you're about to faint. Why this posture works? Keeps blood flowing evenly, supports breathing, keeps your airway open, reduces strain on the heart, makes it easier for paramedics to assist you. If someone is with you, ask them to stay nearby. Let them know if symptoms change. Ask them to stay calm too. Their panic can raise your stress. Stillness is strength. The less you move, the more your body can focus on staying stable. 5. Focus your mind on one thing to interrupt panic. During a heart episode, fear tends to spiral. You start thinking, what if I don't make it? What if no one finds me in time? I can't breathe, I can't move. And those thoughts increase your adrenaline, heart rate, and panic. Here's how you fight back. Focus your brain on one single calming task or image. This is called anchoring, and it's a technique used by trauma therapists and emergency workers. Try one of these. The counting method. Slowly count backward from 100. Or count the breaths. 1 in, 2 out. 3 in, up to 10 and start over. Counting keeps your logical brain online. The memory method. Visualize a peaceful place, a beach, your childhood home, a church. Imagine sounds, smells, colors. Fully engage your senses. Tell yourself, stay here. Stay with this image. Stay present. The name game. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can say to yourself with love. These techniques distract your brain from fear and reduce the body's panic response. They don't replace emergency care, but they buy you minutes of clarity and calm, which can be the difference between helplessness and survival. Let's recap the 5 steps to calm yourself during a heart emergency. Acknowledge the symptoms. Don't deny. Say it out loud and recognize what's happening. Call for help and speak slowly. You need support, and help is on the way. Control your breathing. Long, slow exhales send a calming signal to your body.
Sit upright and stay still. Movement can worsen symptoms. Rest and breathe. Anchor your thoughts. Focus your brain on counting, memories, or your senses. Even if it's not a heart attack, these steps can calm your body, your brain, and give you space to respond with wisdom instead of fear. If you've ever experienced heart pain or panic, just comment yes below, or share what helps you stay calm when it counts most. You might help someone who watches this later and doesn't know what to do. If you found this video helpful, please like the video. Share it with someone over 60. It could save their life. And subscribe to Health Hub for more real-world natural health guidance. I'm Dr. Thomas Carter, and I want you to remember this. In a moment of fear, your breath, your voice, and your awareness are your strongest medicine. You're not powerless. You're prepared. And help is never as far as it feels. Take care, and I'll see you in the next video.